The indications, pre-medication is required for both. The administration time of paclitaxel is 3 hours generally, but in some cases where the patients cannot tolerate, it is extended to 24 hours also. Okay. And in docetaxel, it is just 1 hour, so it's an easy administration procedure. And again, both of them are recommended. I mean, each of them's cycle is of 21 days. So repeated after 20 days, they follow the same 3-week schedule. Now coming to one of the major side effects like peripheral neuropathy. What is peripheral neuropathy? After patients have taken paclitaxel, generally what happens, there is numbness and tingling in the tips of the fingers. So the patients cannot hold pen, cannot hold a knife, or patients cannot write properly because they have that tingling feeling, that numbness feeling, and they cannot hold properly. So there is pinching pain at the tips of the fingers, right? So that is peripheral neuropathy. And what is myalgia? Basically, pain in the muscles that you see, or in the group of muscles, the pain that you see is called myalgia. So peripheral neuropathy and myalgia are more with paclitaxel and they are less in docetaxel. Okay, so therefore, in some cases where the chances that the patients will get peripheral neuropathy are high, then docetaxel is preferred. Okay, and see, especially when you have females who are in the age group of 45, 50, they suffer from any disease like breast cancer, ovarian cancer. If you give them paclitaxel, they will start suffering from peripheral neuropathy, which is reversible after the treatment is over. After 6 months, patients, they don't experience peripheral neuropathy, it declines and gradually it goes away also. But till the time the treatment is on, they will suffer from this peripheral neuropathy. So if the females are in the age group of 40, 45, 50 who are working or at home, or if they are working in the office also, so for such females, if they give paclitaxel, they find it very difficult. So in those cases, then docetaxel is preferred because of peripheral neuropathy and myalgia, which is one of the major side effects of paclitaxel. Though it is reversible, but till the time the treatment is on, they will get the discomfort and it continues for 6 months beyond the treatment also. So that is one of the benefit of docetaxel over paclitaxel. Now, I will not go through all this in detail. These are the different protocols of docetaxel when it is given as a single agent. 100 mg per meter square can be given repeated once in 21 days. And if a low dose is given like 35 to 40 mg per meter square, then this can be given for 6 weeks and repeated after every 8 weeks. So I'll be giving you these slides. You can go through because there are multiple protocols. Okay, the general dose is 75 milligram per meter square, but in some cases it will differ to 100 or 35 to 40 mg per meter square. Okay, so in lung cancer, there are multiple protocols. It can be combined with, so it can be given as a single agent. It can be combined with cisplatin. It can be combined with gemcitabine. It can be combined with etoposide also. And there are multiple protocols. Even in prostate cancer, monotherapy, or it can be combined with estromycin. In gastric cancer also, there are multiple protocols, right? So I will be sharing these slides with you. There are multiple protocols where docetaxel can be given in different indications. But moreover, what you have to remember is the major widely used dose is 75 milligram per meter square. Now, anyone can calculate if the dose is 75 milligram per meter square, and if the body surface area is 1.8, then how much will be the final calculated dose? Will be the final calculated dose if the recommended dose is 75 milligram per meter square and the body surface area of the patient is 1.8.
35 milligram recommended dose, 1.8 demo body surface area. Something like that. Oh, 35. Is that 1.8? Sasos 63 milligram per metric. ሁላችሁም 63
How much?
63 63
How much? Calculate fast,
63
fast. How much will be the dose? How much will be the calculated dose? 75 into 1.8 is how much?
You said what's the dose you said?
Yes.
Recommended dose.
Yeah. See, recommended dose is 75 milligram per meter square. What do you mean by recommended? How many milligram per meter square is the recommended dose? What is a calculated dose? You have to multiply the recommended dose by the body surface area. So 75 into 1.8 is how much? Fast, fast, fast.
135.
135, right? So the final calculated dose becomes 135 milligram. And you have which strengths? You have 20 mg, you have 80 mg, and you have 120 mg in Ethiopia. So what will the patient get? One 120 mg vial and 120 mg vial. And from that 135 will be extracted and given to the patient, and that will be given over a period of 1 hour. Right? So that is how it is calculated. And we have three different strengths: 20 mg, 80 mg, and 120 mg. Right? And 120 mg is in 3 ml vial. It contains docetaxel trihydrate, anhydrous docetaxel, 120 mg, and docetaxel, rather detail 80 mg is in 2 ml vial. It contains docetaxel trihydrate IP equivalent to anhydrous docetaxel 80 mg. Detail 20 mg is in a 0.5 ml vial. But along with docetaxel concentrate vial, you also have a solvent vial, right? So solvent vial has got absolute alcohol in it. The detailed solvent vial has got absolute alcohol in it. So the 120 mg vial was in 3 ml. So there is a solvent of 9 ml which comes along with it. So you have 3 ml is a concentrate and 9 ml is a solvent. In detail 80, 2 ml is the concentrate and 6 ml is the solvent. In detail 20, you have 0.5 ml as a concentrate and 1.5 ml as a solvent. Why you have this? When in the concentrate vial you add the solvent, you will get the strength as 10 mg per ml. Okay, therefore you have these concentrations in the solvent. How is the preparation of detail vial done, or how the detailed premix solution is made? First, you have to remove all the vials from your refrigerator, allow them to stand for 5 minutes so that they come to room temperature, right? Withdraw the entire contents of the solvent vial into a syringe and transfer them aseptically to the vial of detail. Okay, you have removed the solvent vial and the concentrate vial, you've kept them in the room temperature. You withdraw the entire content of the solvent vial and transfer it into the solvent vial. Now shake the vial for 15 seconds by manual rotation and then allow the remix which is formed to stand for 5 minutes at room temperature. See, you have to do manual rotation like this, right? And don't do brisk rotations or brisk shaking, otherwise there'll be lot of froth formation, because the detailed concentrate vial has got polysorbate 80 which is oily in nature. So if you mix this polysorbate 80 with alcohol, there will be lot of froth formation. If there is lot of froth formation, first of all it will take lot of time to settle, and there will be some amount of drug which will be wasted because it will go and stick on the surface of the vials, okay, in the interior surface of the vials. So brisk rotations are not required, only small manual rotations are required. So after the rotation, you keep it for 5 minutes at room temperature so that all the froth settles down. Okay. And the final dose that you will get will be 10 mg per ml, 10 mg docetaxel per ml. So this is how the premix is formed. Then it is diluted to 0.9% sodium chloride or 5% dextrose, and the entire infusion is given over a period of 1 hour. The infusion should not be mixed with any other medications. Only docetaxel infusion is given for 1 hour. And docetaxel infusion is such that it can be given with PVC sets. Also, there is no reaction. So it can be given in the PVC sets also. Now, I'm sure you have seen all the three strengths are available in Ethiopia. You have detail 20, you have detail 80, you have detail 120. Okay, so all these three strengths are available with you in Ethiopia, and depending upon the final calculated dose, you can remove the actual dose from the respective vials and prepare the final dilution. Okay, so just one second.
Okay, question.
Sorry. So this is about docetaxel. We have seen all the indications are very big. The most widely used dose is 75 mg per meter square. There are multiple protocols of docetaxel which I'll be sharing with you all. You can go through them. How the dose is calculated, I'm sure you've understood. 75 milligram per meter square, 75 mg multiplied by the body surface area will give you the final calculated dose. Okay, and docetaxel vials have to be mixed with the solvent which is given, which is basically alcohol, and you get a final calculated dose of 10 mg per ml. And then, as per the recommended dose, you remove the calculated dose and infuse in the NaCl bags or in the dextrose bags and give the IV fluid for 1 hour, and then the docetaxel therapy can be completed. Okay, so this is about detail and docetaxel. I hope the indications are clear and the uh, dose is clear, right? So you have to first understand the different dosages and how it has to be calculated. I hope this product is clear to all of you. Any doubts or any queries? Today, of course, if you see, paclitaxel is very, very widely used, but docetaxel is also being used quite widely in similar indications. And even docetaxel is huge and the scope is very, very large. And in majority of the cases, it is also combined with carboplatin. And the advantage with docetaxel is the infusion time, the administration time is just 1 hour, right? So this is about details, that is docetaxel. As per our plan, we have one more product, which is Plastomet. But what I would suggest is, one second. I mean, we took a lot of time because we had to do the basics of oncology, which took us some time. But the products will not take much time. So I think we can continue with the products tomorrow. What do you say?
Sure.
Yeah,
No, no
because
problem.
yeah, because here our office is actually closed half an hour back. So tomorrow, if you say, we can start at 1:30 as per Indian timing. So yours will be 11
10:30.
o'clock. No, your 10:30.
11:30. Oh,
Your
11 o'clock, I think.
11:30. Yours
11
will be
is now.
11 o'clock.
Ethiopian time.
We are 30 minutes ahead, I think.
Yeah. So if we start at 1:30, will that be okay for you? You will get time for your other training also.
Uh, is that what time? In what time? Indian time or
Uh,
Ethiopian time?
According to Indian time, it is 1:30. According to Ethiopia time, it will be 11.
No problem.
Yeah, because you have another training program in the morning, right?
Yes.
Okay. So we'll start tomorrow as per your timings at 11 and ours will be at 1:30.
All right.
Yeah. So we'll be able to complete all the products tomorrow. And
Okay.
tomorrow, if required, we may stretch also. Because at least your basics are clear. How the dose has to be calculated, that is clear. And mode of action is clear. So understanding products will not be difficult. Right?
All right.
So fine. So we can call it a day today.
Sir.
We can call it a day today. We can wind up now.
Yeah. Yeah. Sure. We are okay for that.
Okay. 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 So fine. You want me to mail the slides today only, Kimia,
Yes,
so
Mr.
that they can grow. Yeah, you want me to mail you all the slides today itself so that they can go through it?
Okay. You can share for me and I will share for them.
Okay, I'll mail it to you and you can share with them. So tonight they can go through the slides and if they have any doubts or queries, they can discuss with us tomorrow, right?
Sure. Sure.
Okay, then we can take your leave, Kimia, and of
Thank you
course
very
all the others. If I can remember few names, Tariq,
much. Appreciate
Meron,
and
Fozia, Adiz, Eden, I can remember few of your names.
yeah, we. So thank you very much.
Okay, 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 okay. So good.
Thank you.
Thanks from our side also. Thanks for being good audience and good students too. Yeah. So I think Shiva could not take sessions tomorrow. Majorly it will be Shiva's session. Yeah.
Yeah, tomorrow will be my session.
Yeah, yeah, yeah.
No problem.
Okay, Kimia.
Okay.
Uh,
Thank you.
okay, have a nice day, whichever is balanced. So have a nice evening and then we meet tomorrow. Yeah.
Okay. Yeah. Bye.
Okay, okay, okay.
See you.
Bye. Shiva, you can
Thank you.
stop
Bye.
the recording. Bye bye, bye bye, bye.